Hello, everyone. I'm so glad y'all are here. I am Stacy Murphy, and I'm the pelvic health physical therapist at Physical Therapy of San Marcos and Physical Therapy of Wimberley. And today is my bladder health class. So I'm so glad you're taking the time to be here. I have a few housekeeping things to make sure that you are in the right place. So in the chat, I added my Google Doc over the class that I'm going to be going over today. And in this class, I hope that the handout is, first of all, really helpful, but I want you to know a few things. I want you to know if you're in the right place. So I have a mind's eye of who I'm talking to whenever I'm giving this class. If you do not relate to these 3 different people, then this class may not be the one for you. It doesn't mean that this information can't be helpful, but it means that I may give this information to you in a different light if you do not fall into these categories. So people who don't fall into these categories are someone who's suffering from chronic pain, bladder pain or spasms, or has a neuromuscular condition, or has their muscles just naturally really tight. I'm actually speaking to more of a weaker pelvic floor, maybe post-op, but even post-op, I would speak a little bit differently. So in the same breath that I love giving these talks, I actually love giving them to people one-on-one. So if you feel like that may not pertain to you, it may not pertain to you. And if I meet you in person, I may not give that information to you, or I'll add a spin more specific to you. So I hope that that's helpful. So in my mind's eye, I'm picturing 3 different people. First, we'll call her Kimberly. Kimberly is 20 to 40 years old. Her kids are 1 to 10 years old. She has anywhere from 1 to 5 or 6 children. And she just wants to get back to being her regular self. And her regular self is jumping on the trampoline with her kids without coughing, laughing, sneezing, leaking. And she wants to get back to exercise. And then she also wants to have her tummy look like the way that it used to be. So I would speak to her about this handout, and I would give her this folder at the evaluation. The second person I'm thinking of is Linda, and she is postmenopausal, 50, 60, 70, maybe even 80. I have treated 90-year-olds in the past. And she may or may not have had children, but she feels heaviness down there and she leaks a little bit, but sometimes her bladder just plain empties and she has no warning of it. And so it's very disturbing to want to go out and about in the community and shop and play with and have fun with your family and friends if you think that this may happen to you. So I'm thinking of Linda. And then my third person that I'm thinking of is Dale. And Dale had his prostate removed or a prostate surgery in the past, anywhere from 6 weeks to 10 years. And he wants to get back to being able to play pickleball and drink coffee and not have issues at the winery whenever his bladder just typically wants to leak. So if you can relate with any of those 3 people, then you are in the right place. If you're like, that is not me, then maybe this class isn't for you. But I hope to make more classes specifically to you. And my evaluation, pelvic floor evaluation one-on-one, would not look like this. So without further ado, I am going to go over the talking points on my handout. So the first page is all about bladder health. And then I have a whole other page about dietary things that may affect your bladder. Then the whole next couple of pages is how constipation and the back side of the pelvic floor may affect what's going on in the front. So I also like to point out these are the pelvic floor muscles in I'm screen sharing. Where is my screen? This is on my wall in both of my offices. So this is a good way to show the pelvic floor muscles and to introduce the pelvic floor muscles. They are beautiful. They look like a rotator cuff, but they're down here and they're helping and support. We've got parts of this that contract volitionally and parts that are contracting and relaxing, and we're not even telling it what to do. It is so cool. So this is to orient you. This is the front of you. This is the back. This is your sacrum, your tailbone ends right about here. These are your ilia, So this is your SI joint right here. And in that, this space is those like butt dimples where a lot of people have a lot of pain. Um, and vaginal opening, anal opening. And so if someone's having bladder issues, I do like to point out that even though I know you're having just leaking in the front, but I kind of want to know what's going on in the back because all of this space is really, really little and they're best friends. And the same muscles that are holding up your urine are the same muscles that are wrapping around the anus and are the same muscles that attach all the way to your tailbone and right at the very top of your sacrum. This little hole is where some sacral nerve roots come out. So if you're having pain, here's your piriformis, that sciatica muscle, where the sciatic nerve runs through. So there's a lot of things going on right here. And so as I ask questions that may not feel pertinent to you, they may actually be, and they're helping me drive the care that I'm going to provide for you. I have another picture that I really like that's also in my room. And so this just kind of gives the same schematic, but without the bone, without the muscles. So it just shows like how close that tailbone is to the anus. They connect. And there's the little sacral nerve roots. And then here's where your hip bones are coming in and out. And all along this whole front of you is where your abs attach. You've got your side bending muscles attaching at the top part. At your sit bones is your hamstrings, your inner thigh, your glutes. And remember what's going on in the middle. All of your pelvic floor muscles. So if you're having tightness or weakness on the outside of your pelvis, then you're definitely going to have issues on the inside. So I hope that helps you orient yourself. So those two pictures are in my office, and also is the whole point of all of this is for you to know, I have this on both walls, is that you are fearfully and wonderfully made. And now let's get into a little bit about me. So I'm going to introduce myself in the next slide, the next lecture.